Welcome to Pharmacy Prep, PTCB mock exam 11. This mock exam is about drug stability and storage conditions. Let's start. What is the drug stability? The definition. A. The ability of the drug product to maintain its potency and effectiveness during use and storage conditions. B. The rate at which a drug degrades at room temperature. C. The ability of the drug to dissolve in a liquid medium. And D. The ability of the drug to remain non toxic. The correct answer is A. The drug stability is the ability of drug product to maintain its potency and effectiveness during the use and storage conditions. Also, the drug stability refers to extent to which a drug form remains the same potency, effectiveness, and characteristics it possessed when it was made. Here, types of stability. There are three types of stabilities definitions: physical stability, which includes factors such as temperatures, humidity, light, and packaging, and pH. Chemical stabilities mean drugs that are degraded by chemical reactions such as hydrolysis, oxidation, photolysis, isomerization, polymerization. Also, drugs can be unstable due to the microbial contamination or lack of preservatives. So here today we'll follow the questions related to factors affecting on drug stability. Here factors includes temperatures, light, pH of the formulations, and humidity or moisture, and the packaging of those drug products. These are the few factors that significantly affects on drug stability. Let's look at the questions on each factor. Temperature factor. According to United States of Pharmacopoeia, the room temperature is 46 to 59 Fahrenheit, B 68 to 77 Fahrenheit, C 36 to 46 Fahrenheit, and D 86 and above. The correct answer is 68 to 77 Fahrenheit is, according to United States Pharmacopoeia, that's considered as controlled room temperature. Here are other temperatures that are recommended by the USP that include refrigeration temperature, which is 36 to 46 Fahrenheit, and also warm temperatures are above 86 Fahrenheit or 86 to 104 is considered as warm temperatures. Next, a refrigerator in which temperature is controlled between A 46 to 59, B 68 to 77, C 36 to 46 Fahrenheit, D 86 to 104 Fahrenheit. The correct answer is C. 36 to 46 Fahrenheit is the temperature for refrigerator or fridge temperature. However, if you have a question related to just taking one mean temperature from not the range, if you have to take a mean, then 5 or between those 36 to 46 Fahrenheit would be a mean temperatures. A product label says to the store in a cool place. What is the correct range of control temperature? 68 to 77 Fahrenheit, 46 to 56 Fahrenheit, 36 to 46, and 32 to 50 Fahrenheit. The cool place is 46 to 56 Fahrenheit. That's the correct answer. Next questions are related to moisture sensitive or affect factor moisture factor on the drug stability, which is commonly used in drug packaging to absorb moisture and maintain drug stability. A. Desiccants. B. Preservatives. C. Emulsifiers. D. Colors. The correct answer is desiccants. Desiccants are used in most packagings, especially for drug bottles. They do help in absorbing moisture in those medications. Next, in which type of drug packaging is a desiccant most likely to be found? A. Blister bags, tablets in the bottles. C. Injectable vials. D. Topical cream. The correct answer is tablets in the bottle. Most tablets bottles contain desiccants, and that helps in preventing moisture or further absorption of the moisture into the tablets. Next, which of the following is a common desiccant used in pharmaceutical packaging? A. Calcium carbonate. B. Silica gel. C. Citric acid. D. Starch. The correct answer is silica gel. Silica gel is the one that contains most of the drugs desiccants. That's the reason why it is warning, do not swallow those desiccants or do not take it or use it because that contains silica gel, which can be harmful if it is swallowed. Next, the light effect factor or light sensitive drugs. Most drugs are light sensitive. However, some drugs are more sensitive than other drugs. Here is the question. Which of the following drug is most affected by light exposure and require protection from light during storage? A. Amoxicillin. B. Furosemide. C. Metformin. D. Lisinopril. The correct answer is furosemide. Furosemides are stored in away from the light and also have to be stored in light sensitive containers to prevent light exposure, and that results into degradation of furosemide. Next question is about the pH factor or pH sensitive drugs. Which type of drug formulation is designed to protect acid-labile drugs from acidic environment of the stomach? A. Extended release tablets. B. Enteric coated tablets. C. Sublingual tablets. And D. Chewable tablets. The correct answer is enteric coated tablet. The purpose of enteric coated tablet is prevent from acid hydrolysis. When acid is exposed to the certain drugs, drugs can be degraded or broken down. That is process known as hydrolysis. However, enteric coating helps to prevent those chemical reactions that happens due to the acid present in the stomach. So the correct answer is enteric coated tablets designed to prevent acid-labile drug from acidic environment of the stomach. Next, a temperature controlled supply chain for medication that require refrigerator temperature range during the distribution and storage from the time of manufacture to the administered to an individual is referred as A. Cold chain. B. Room temperature. C. Refrigeration. D. Freezer. The correct answer is cold chain. Cold chain is a maintaining temperature of the fridge during from the time from the time it manufactures, distribution, and also dispense to the patient until patient takes it or patient use it. Until then, you maintain into the fridge temperature. That process of supply chain is known as cold chain. Like most vaccines, they do have to be cold chain. Next process is effect of the air or oxidation on the drugs. What is the primary function of antioxidants in the drug formulation? A. To improve taste. B. To enhance the absorption of the drug. C. To prevent oxidation of active ingredients. D. To reduce viscosity of the formulation. The correct answer is to prevent oxidation of active ingredients. The exposure of the air to the drugs can result into process called oxidation, and oxidation results into breakdown of drugs and chemical that results into drug instability. Here are the examples of factors that are container storage containers. There are storage containers such as plastic bottles. Most commonly used are plastic bottles. However, some glass bottles, some products are not stable in those plastic. They interact with the plastic. So therefore, you store them in the glass bottles. And also, the drug that are air sensitive, which degraded or which undergoes oxidation due to the oxygen or air, that require tightly sealed containers to prevent moisture control, airtight, and also that prevents the degradation or instability of the drug. So here is a question about containers. Which type of container is recommended for storing medications that are sensitive to air exposure? A. Blister packs. B. Airtight containers. C. Cardboard boxes. And D. Transparent bottles. The correct answer is airtight containers. Airtight containers are used for preventing exposure of air, and that enhances drug stability. Next, which of the following medications should be stored in glass container due to the risk of reaction with plastic containers? A. Dapagliflozin. B. Cyclosporin solution. Brand is Neurol. C. Singular Montelukast tablets. D. Amoxicillin suspension. Correct answer is cyclosporin solution. Cyclosporin solution react with plastic containers, so therefore that is stored and supplied in the glass containers. Next, what should a pharmacy technician advise patient about storing dabigatran at home? Store in the refrigerator to prolong shelf life. B. Remove all capsules from blister pack and transfer them to pill organizer. C. Keep the capsules in the original blister pack until used to protect them from moisture. D. Place the capsule in transparent container to monitor them visually. The correct answer is keep the capsules in the original container until use them, so that way it protects from the moistures. So that is a specific recommendation for dabigatran because it is a moisture sensitive. Next, what is the best storage condition for nitroglycerin sublingual tablets to prevent degradation from light and moisture exposure? A. Store in a clear plastic bottle at room temperature. B. Store in original glass bottle, tightly capped, away from the light. Store in a blister pack and refrigerate. Store in a freezer at all time. Correct answer is store in the original glass bottle and tightly capped away from the light because nitroglycerin is light sensitive and also moisture sensitive. And also the plastic bottles caps can have corrosion with nitroglycerin, so therefore glass bottles are preferred for nitroglycerin. Next, which of the following drugs should be stored in original package in order to protect from moisture? A. Atorvastatin, B. Dabigatran, C. Amoxicillin, and D. Metformin. The correct answer is Dabigatran, which is a brand products which require to be stored in original container until it is used. Next, questions are related to drug stability on the different dosage forms, like solid dosage forms, liquid dosage forms, and topical dosage form. Among these three dosage forms, solid dosage forms are considered as a more stable or more stable compared to liquid dosage form. Whereas liquid dosage forms contains water and therefore they do frequently unstable, not stable enough, or they results into microbial growth, or it can cause degradation in presence of oxygen or acids and bases. Here is the question about which of the following dosage forms are typically has a greater stability compared to liquid dosage forms. A. Creams, B. Tablets, C. Syrups, B. Suspension. The correct answer is tablets. Tablets are generally considered as more stable compared to the liquid dosage form because liquid dosage form can have chance of bacterial growth or because of chemical instability is much higher in liquid dosage forms compared to solid dosage forms. Especially the tablets are more stable among solid dosage forms. Next, which of the following is sign of drug instability in tablet dosage form? A. Tablet discoloration. B. Tablet disintegration. C. Clumping together. And the correct answer is all of them. All those are indicators of tablet dosage form are not stable enough, such as discoloration of the tablets or breaking down, disintegrating the tablets, or clumping together. It is sign of tablet instability. Here, other products signs of drug instabilities are like suspensions can form crystal formation or can have a inability to resuspend, and creams and ointment can be separated into two layers, such as oil layer and lipid layer, oil layer and water layer, or change in the texture of this ointment, cream, or change in the color or smell can be possible. Whereas suppositories, sign of drug instabilities include suppositories can be softened or hardened or could be melted at storage conditions, or that can also change in the shape and color, also indicator of sign of drug instability. Here are the liquid dosage form. Commonly used liquid dosage forms are solutions, suspensions, eye drops, and injections. So here is the question. Which of the following is a common sign of instability in suspension or solution? A. Change in the consistency. B. Discoloration and clumping. C. Cluster formation and expanded bottle due to the gas formation. And D. Excessive softening or hardening. Correct answer is crystal formation or expanded bottle due to the gas formation. Suspensions, they do contain particles in liquid, so therefore, if it is not stable, they form the crystals. And also, bacterial growth can result into gas formation, and that is what a sign of instability for suspension or solutions. Here are those next questions are related to drugs with reduced time of stability, such as antibiotic suspensions have a limited time of stability, eye drops have a limited time of stability, insulin, compounded preparations, vaccines, and also IV reconstituted preparations. they do have reduced time of stability. So following questions follows on those items. Next, antibiotic suspensions. How long is amoxil or amoxicillin suspension stable after reconstitution? A. Suspension is stable for 14 days if refrigerated. B. Stable for 7 days if refrigerated. C. 10 days if refrigerated. And D is stable at room temperature. The correct answer is suspension, amoxicillin suspension is stable for 14 days if refrigerated. So therefore, that is, and however, it can be stored at 10 days at room temperature, 7 days at room temperature. So this is for amoxicillin dry powder reconstituted suspension, whereas amoxicillin capsules can be stored at room temperature. Next, which antibiotic suspension should not be refrigerated as it can become too thick? A. Ciprofloxacin. B. Cephalexin. D. Clindamycin. D. C. Clindamycin. D. Cefdinir. The correct answer is clindamycin. Clindamycin should be stored at room temperature. If it is stored in the fridge, it can become too thick and it will be difficult to measure and use the clindamycin suspension. Therefore, keep it at room temperature. Here are the examples of suspension, important suspension and their storage condition, such as amoxicillin can be stored 14 days in the fridge, and azithromycin can stay at room temperature for 10 days. Clarithromycin can stay 14 days. Clindamycin can stay 14 days. And sulfamethoxazole trimethoprim can stay 14 days. Ciprofloxacin can stay at room temperature for 14 days. Next, which of the following antibiotic suspension is stable for 10 days after reconstitution? A. Zithromax or azithromycin. B. Amoxicillin. C. Keflex. D. Ciprofloxacin. The correct answer is azithromycin. Azithromycin suspension stays at room temperature for 10 days after reconstitution. Next, which suspension require refrigeration to maintain stability? A. Cefdinir. B. Cephalexin, brand Keflex. C. Azithromycin. D. Ciprofloxacin. The correct answer is Keflex or Cephalexin that has to be stored in fridge after reconstitution. Here are the examples of the other cephalosporins storage conditions. Among them, uh, two cephalexin, Keflex stored in the fridge, and also ceftin, which is cefuroxime that have to be stored in the fridge as well. Whereas other cephalosporins suspension can be stored at room temperature. Next, what must a suspension be before measuring and administering the medication? Shake the bottle well. Do not shake the bottle. C. Store bottle in the fridge. D. Place bottle on the flat surface. The correct answer is shaken the bottle well before measuring them and before use. Next questions are about insulin instabilities. Tresiba is a long-acting insulin. What is the generic name? A. Glargine. B. Levemir. C. Degludec. And D. Insulin NPH. The correct answer is Degludec. Degludec is the generic name for Tresiba, which is a long-acting insulin. Here are the examples of long-acting insulins and their names, such as Tresiba is a Degludec, Lantus is a Glargine, Levemir is for Detamir, Toujeo also a Glargine but comes with the 500 units in 1 ml insulin. compared to Lantus, which is 100 units per mil. Basalgar is an insulin glargine biosimilar. Those are the long-acting insulins. Next, how long can a open vial of Humalog insulin Lispro stored at room temperature? A. 14 days, B. 28 days, C. 42 days, D. 56 days. The correct answer is 28 days. After opening a vial, should not keep more than 28 days. Should be maximum 28 days. You have to use it. If not used, after 28 days, have to be discarded. Here are the examples of insulins, types of insulin, and their storage condition. Like storage unopened at room temperature or open. In both cases, here, room temperatures. Insulin vials generally stored at 28 days or 4 weeks. Insulin Lispro Humalog is 28 days. Aspart, which is a Novolog, 28 days. Glargine Lantus, 28 days. Only two of them are higher, such as Levemir can stay up to 46 days, which is 6 weeks, whereas Degludec can be up to 8 weeks, can be at room temperature. And all pens, insulin pens, are stored at room temperature. However, insulin Degludec pen can be refrigerated. Next, what is the recommended storage condition for unopened insulin vial before dispensing? A. Store at room temperature. B. Store in the fridge. Do not freeze. C. Store in the freezer. D. Store in dark cabinet. The correct answer is in pharmacy, you store the insulin in the fridge. However, once dispensed, patient can store at room temperature. Next, which insulin product has the longest stability period when stored at room temperature? A. Humalog, B. Lantus, C. Levemir, D. Tresiba. Correct answer is Tresiba. Tresiba can stay 56 days at room temperature. That's 8 weeks. Next, how insulin pre-filled pens be stored after opening. After opening. After opening, A. Always in the refrigerator. B. Room temperature. C. Freezer. And D. Dark without temperature restriction. The pre-fill after opening insulins, pre-fill insulins after opening, that has to be at room temperature. Next, what is the stability period for open vial of Lantus? A. 10 days. B. 14 days. C. 28 days. And D. 42 days. Correct answer is 28 days. The Lantus stored at room temperature for maximum 28 days. Next, questions related to eye drops stability. What is the correct about drug latanoprost? It is an eye drop stored in the fridge. It is an eye drop stored at room temperature. It's an oral liquid stored in the fridge. And correct answer is eye drop stored in the fridge in the pharmacy. However, once dispensed, patient can store at room temperature for 6 weeks. So these are the all Prost, which are the prostaglandin analogs of eye drops. They are all stored in the room temperature. However, some eye drops, such as timolol, can be stored at room temperature. So there are more other conditions of the storage condition for the eye drops. Latanopause and its brand is Zalaton, and combination with timolol, they can stay at room temperature for 6 weeks, whereas combination can stay up to 10 weeks. I have to correct this one here. This is supposed to be 10 weeks. Timolol can stay at room temperature, ciprofloxacin eye drop at room temperature, whereas azithromycin eye drops can stay only 14 days at room temperature. Next, Timolol or Timoptic is eye drop container stored at room temperature. Next, how should azithromycin eye drops, brand Azazide, be stored after opening? A. Store at room temperature for up to 6 weeks. B. Keep refrigerated once opened. Store at room temperature for 14 days. C. Store in the freezer all the time. D. Keep refrigerated up to 4 months. The correct answer is keep refrigerated once opened. Store at room temperature for 14 days. This is slightly different than azithromycin's oral suspension. This is for eye drops. Next, which of the following is the most accurate guideline for storing eye drops after they have been opened? A. Eye drops should be stored in the refrigerator after opening. Eye drops should be discarded if opened more than 1 month ago, unless the label states otherwise. C. Eye drops can be used indefinitely after opening if stored at room temperature. D. Eye drops must always be discarded after 7 days of opening, regardless of label instructions. So the correct answer is B. Eye drops should be discarded if opened more than 1 month ago, unless the label states otherwise. Next, compounded preparation stability. According to USP, what is the general rule of beyond use date? Do not use after aqueous oral liquid. A. Do not use after 14 days. Do not use after 6 months. Do not use after 1 month. And do not use after 1 year. The correct answer is do not use after 14 days. All aqueous water containing oral liquids, compounded oral liquid should not be stored, cannot be used if it is made more than 14 days ago. So this is applies to all aqueous containing, whereas ointments and non-aqueous containing creams, etc., mainly the ointments that can stay up to the maximum 6 months. That is according to the USP. Whereas other liquids such as topical, dermal, semi-solid preparation, lotions, etc., can max 30 days, can stay at generally at room temperatures. Next, sterile liquid stabilities. What is the common indicator of instability in the sterile liquids such as eye drops or injectable? The correct answer is change in color, cloudiness, and formation of surface film. That's a sign of instability in the sterile liquids. Next question is about biologic stability. Adalimumab, a brand is Humira, is biologic drug what storage condition? A. Store at room temperature. B. Store in the fridge. C. Store in the freezer. And D. Any temperature. Correct answer is store in the refrigerator. Like all biologics, here are some examples such as Humira, which is a generic name is adalimumab, Enbrel, etanercept, Remicade, infliximab, and Simponi, golimumab, and Cimzia, which is a setrusumab. These all are monoclonal antibodies or protein products that has to be stored in the fridge to maintain the stability of those products. And all of them are injections. Next, vaccines. Most vaccines are stored at A. Room temperature. B. Stored in the fridge. C. Stored in the freezer. Any temperature. The correct answer is all most vaccines are stored in fridge in the pharmacy. Next, drug stability and expiration date. The expiration date of the drug on the manufacturer label is 04/2026. What day of the month do these medication expire? The first day of the month, the last day of the month, the middle of the month, and the prescription date. The correct answer is if label says 04/2026, the last day of that month, such as April, last day until the That time patient can use this medication. So next, what does the expiration date of a drug product indicate? The date after which drug become toxic, the period during which the drug is known to remain stable when stored correctly, the date when the drug should be destroyed, the time when the drug will change its physical appearance. The correct answer is the period during which the drug is known to remain stable when stored correctly. Next, if a drug is used past its expiration date, what is the potential risk? A. Increased potency leading to overdose. B. Drug may become more effective. C. Reduced potency and making the drug less effective. D. Better taste and flavor of the medication. The correct answer is if it is beyond expiry date use, that can result into reduced potency and making the drug less effective. So therefore, this something can be potentially riskier. Next, which of the following is an example of drug that may become toxic after expiration date? A. Acetaminophen. B. Brufen. C. Tetracycline. D. Amoxicillin. The correct answer is tetracycline. Tetracycline can become toxic after use if used after expiration date. Next, miscellaneous drug questions are: what is the proper storage condition of NuvaRing ethinyl estradiol etonorgestrel, which is a vaginal ring contraception, hormonal contraception? A. Stored in the freezer. B. Keep in the room temperature for up to 4 months after dispensing. Store in the refrigerator all time. Keep it room temperature up to 1 year. The correct answer is keep at room temperature for up to 4 months after dispensing. All right, so with this information, thank you for watching. Stay tuned for more videos and give a big thumbs up and subscribe Pharmacy Prep channel. Thank you and see you again.